quarantined healthy people.
Yes. Yeah, that's such a good point because you know what? That is the difference, right? You quarantine sick people. You don't quarantine the healthy people. Now, old people, compromised immune system people, maybe. You are the people that need to be worrying about. The rest of us, you know what? Get out. Take your
Right.
chance. I'm in my mid-50s. I have that 20% chance of dying if I get it, I guess. But you know what? Combine that with the actual chance of getting it, it's pretty slim for me, you know? And I'm a healthy guy. I wash my hands, and I keep my sanitizer in the car, and I do all the things that I'm supposed to do that any normal person who's got a little common sense would do in this situation. But leave that to me. Don't close all my opportunities. I want to go out and have dinner, dude, so bad right now. I just want to, the first place it opens, I don't care if they're legally open or not, I'm going to be there. I'll wait in line. I want a drink and I want dinner at a restaurant somewhere.
Right. Well, it's, and you think about it too, I think we have enough empirical evidence with the coronavirus just as we've gone on, when you break down the demographics of it and who was affected by age and by medical condition, it's clear, and that it's been stated that obviously the elderly and underlying conditions are the drivers of what may cause you to die from this.
Right.
Now, even beyond that, you look over years of influenza, which obviously we have years and years of empirical data with a vaccine, with new vaccines, because it continues to mutate. But, it is a flu. It's a virus. It's a flu. Yes, is it more serious than influenza? Without a doubt.
Well, it's certainly more contagious. I'll give them that. I think the data shows that. Until we know the full range, and let's remember, 59 million people had H1N1, right? Back in the day. 59 million Americans ended up having, don't ask me how they got that figure to be so, but I guess it's good data, right? 59 million. If we don't have 59 million already with COVID, who have gotten it and passed it and didn't have any problems, didn't even go to the doctor for it, I'm betting we've got to be, 30, 40 million people. When you take that and then add the death figures up and do the math, I don't think it's going to be any more dangerous than the flu, frankly.
Correct. And you've seen the video, obviously, the two doctors.
Yes. Right. Which keeps getting deleted from YouTube, right? You want to talk about censorship.
Exactly right. Yeah, there's the part of my aggravation.
Yeah.
And, the fact that they're, everything they said, and I am not a doctor. I'm not a medical professional, but these are two doctors who run medical centers. And I like the fact that in those videos, they spoke solely about, this is not a perspective. It's not an op-ed. This is our data.
Yeah.
Our medical centers. And they said, you conclude that this will have a death rate, and they extrapolated from, the number of deaths versus, the number of reported cases, and then what you can expect that from the general population. And it turns out to be a 0.1 or 0.2% death rate, considering the entire population, which is just flu.
Yep. Yeah, I don't want to downgrade it and make people think, Gary he thinks it's a hoax. No, it's not a hoax. I understand.
No.
It's there. It's more contagious than the flu. Is it more deadly than the flu? I'm not betting that it is, but we've done more than we should have. I mean, shutting down this, Gretchen Whitmer, I think the whole idea of the shutdown was to flatten the curve and keep the hospitals from overwhelmed. And now, doesn't it seem to you that goalposts has shifted? It's no longer just flattening the curve to keep the hospitals from being overwhelmed. Now we want to make sure nobody gets it, nobody dies of it.
Beaumont Hospitals, our largest medical system in Detroit, is laying off doctors and nurses.
Yeah, the Wayne County. Well, now I heard they just started opening the Wayne one that they had shut down for a few weeks is now starting to open back up again, which is a good sign, right?
You're literally closing, like we discussed earlier. Your actions have caused medical facilities who could treat patients to close.
Yeah.
That, to me, right there, says you went too far.
Yeah, and who can't see that? I mean, I don't feel like I'm putting the tinfoil hat on when I say, are you people trying to destroy our private healthcare system? Is that what is behind all this? You know, did Joe Biden meet with Governor Whitmer up in, was it Lexington, Michigan, and tell her, destroy the economy, destroy your healthcare system, do whatever you got to do over the next few months so that we can get elected as Democrats and go to single payer and have the government run everything. I know I'm putting the tinfoil on, right? But somebody is not using, what data is she using and what common sense are you using when outstate Michigan, away from the big centers of Flint and Detroit, you've got hospitals closing. Will they recover? Will they even reopen?
Right.
You know, is this their excuse to institute a government health care plan? Oh, we're going to have to put a government hospital up there because nobody's got a private one anymore.
Well, and you've seen, if you've seen the map, Gary, of the a density map with a color chart of all the counties in Michigan. To your point, you got Wayne and Oakland County and Genesee County, and then outside that, so you've shut down the whole state. And I think I just saw yesterday the last county in Michigan finally recorded one official case.
Yeah. So every county in Michigan now has at least one case.
Right.
Yeah. Okay. Yeah, because they're saying, I just saw an article yesterday that half the counties in the country have not even had one case yet.
Right.
I'm thinking, why are those counties and states shut down?
Correct.
You know, I honestly, I think it was, is it North Dakota where they didn't shut down? The governor of North Dakota, Nome, whatever her name is.
I believe so. I believe you're right. Yeah.
All right.
And then
so
back up.
Yeah, if you don't have anything, and that's the beauty of being, a republic. We have 50 different states. Let each state do it differently. I understand Cuomo and New York have some issues. I got a buddy who I had on the last podcast, Pat, was in upstate New York, and he didn't have the same problems, but they weren't as good as like upstate Michigan, right? So it is interesting, and I'm glad you're on the same page as me, anyways, because I'm in that book. I'm a firm believer that, you know what, let's get our businesses back to work. Keep your hand sanitizer going. Wash your hands. Wear a mask if you're in a crowd. Let the restaurants open back up, but let's go slow. Give them 25%, 50%, whatever. Get them open, because you know what, I've got a brother in that fast food business, and he's been hurting. He's surviving, but he's hurting, right? Because at least he's still got his drive-through stuff.
Right.
But some of your favorite local restaurants may not make it back. Even if she said tomorrow open back up, but 25%, they may not survive.
Well, one of the ones I've saw, and we don't, they're not big here in Michigan, but I believe there's one Fountain Walk in there in Novi, Punch Bowl Social, done.
Really? Oh, that's too bad.
Now, and you don't see a lot of them, but if you've ever been to one, they're big places. And, so big places, a lot of customers, a lot of revenue. So it's definitely big business, a national chain, and they're done.
Yeah, and those are a big place like that, too, is the kind of place that says, all right, I can do 50% of my tables, and stay afloat. At least temporarily, right? Why wouldn't you? It just drives me insane. We've put ourselves into 14% unemployment in a space of 45 days from virtually no unemployment. When they say 3.5% is virtually non-existent unemployment, right? But
right.
Now we're at 14, probably going to 20, unless we start opening things back up.
Right. And like you, I am not a tinfoil hat wearing conspiracy theorist in any way at all. But, you see some of the videos, you see the pandemic video that I'm.
Yeah. Yeah.
And like I said, I'm not a conspiracy theorist, but you hear a lot of things that you can call them lies if you want. You can say they're illogical, I guess, but it certainly presents a point of view that seems plausible.
Right. Yeah, I that pandemic video, Markovitz, whatever that lady, the doctor lady, the research lady. Now, granted, I'm not I'm not going to say she's perfect and a saint or anything else, because even in that video, there are statements that she makes that makes you go, I know that's a lie. Right? I don't know where you're picking that up from, Lay. But I've seen enough other evidence, and this is where I'm proud to put on my tinfoil when it comes to Bill Gates and Anthony Fauci, because you know what? Something with that guy just stinks. He's been, if nothing else, he has been wrong so many times since January that nobody should be looking at him and saying, oh yeah, he's the expert, we should listen to him. Right. When you said we don't need to worry about it, well, then we need to worry about it. No, you don't need to wear a mask. Yes, you should be wearing masks. Hey, come on, Fauci. You're the expert with 40 years in the field. You think statistically you'd be right more than half the time. Right?
Yes, absolutely.
Yeah, it's crazy. So we'll try, maybe we'll get into that the second half of the show anyways, but I want to see, what do you think? We heard today the Big Three is going back on the 18th in Michigan. Is that what you heard?
Correct. Yep.
Okay, so if they're opening up the 18th, I got to imagine most of our Tier 1s and Tier 2s will be up before, during, or after that opening of the Big Three.
1 week. Yep.
Yeah, so that's going to happen. I haven't been told when we're going back yet, but I'm actually looking for. How are you dealing with it?
I don't like it.
You don't like it, or you do like it?
I want to get back to work. I do not like the work from home situation. It's just, and as I said, I have perspective where like it's not affecting me financially at all, and I do not like the lockdown.
Right.
And I'm not affected financially.
Yeah, I can tell you this. For me, I always thought, that was my dream job. I want to find that job where I can work from home. Right? And after 6 weeks of this or whatever, I'm thinking, no, I've got to have an office to escape to. It's funny how your perspective changes, right? All of a sudden, my home, I love my house, I love my home, but now it's my cage, and I want to get out of here, man. I'm ready to go back to work. Send me to work. I miss the people. I miss the talking. I miss going and drinking that lousy coffee in the kitchen area. I miss all that stupid stuff.
I think me more than anything, Gary, like I said, it's just movement.
Yeah,
movement out, around, change.
I think it takes a mental effect on you, a mental toll too, because there are a number of times I've got a good reason to go to the store for something that I need. It's essential. And I think to myself, I really don't want to go out and put on my mask and go to the store and deal with the people, and I'm thinking, slap yourself, right? Get out in the car and get out there and buy that. What are you thinking? What are you holding back? So even a guy like me can fall into that mental, I don't even know what to call it, man. It's something it's insidious the way it creeps up on you. And I imagine there are people who aren't as strong-willed that, no longer want to leave their homes.
Well, it's I saw, and I haven't found it. I wanted to find it and send it to you. It was a Charlie Brown meme, and it shows Charlie Brown and Snoopy sitting on the wall, like their discussion wall, facing away from the viewer. And Charlie Brown's little voice bubble says, if locking down saves just one life. And Snoopy's little voice bubble says, if locking down causes just one suicide.
Bingo, dude. That is, if you find that, send that to me.
Yeah.
Because that is absolutely perfect. If Whitmer is trying to save every last life by locking down, how many people are dying of a heart attack or cancer or something else because they didn't go out and get their checkup or do their next visit or whatever? How many people have died of suicide, or how many people may have killed their spouse or something, somebody in the home, something bad happened? At what point did you destroy an entire economy? My favorite hashtag for Gretchen Whitmer is Whitmer lies and Michigan's economy dies, because I think she's lying completely about the data. I have no idea what she's using to make the decisions that she's making. There's no reason not to open up certain parts of Michigan, period.
Absolutely. And, well, you've seen the data, I think, as of today, we're at